Margaret, at 67 years old, never thought that a familiar name could suddenly disappear from her memory. It was a quiet evening. She was sitting with her grandchildren in the garden, telling them a story from her childhood. The atmosphere was warm and laughter filled the air, but in a strange moment of silence, Margaret suddenly stopped. She looked at her grandchild sitting beside her, stared into his little eyes, and said, "Wait, what's your name again?" Everyone laughed, thinking she was joking, but Margaret didn't laugh. Those seconds felt like an eternity. Her heart started pounding fast, her hand trembled, and she forced a nervous smile that hid a deep worry. That night, she sat alone wondering, is this just normal forgetfulness that comes with aging? Or is it an early warning sign of something more serious? As we age, the brain undergoes natural changes that affect short-term memory, which is common and not always a cause for concern. Forgetting where you placed your keys or having trouble recalling the name of someone you recently met may simply be a natural result of a slight slowdown in processing information. However, there is a clear difference between this type of occasional forgetfulness and more serious signs that may indicate the onset of a health problem. For example, if a person begins repeating the same question or story multiple times during the same conversation, misses important appointments despite reminders, or feels lost in places they have known for years, these are signals that should not be ignored. Also, normal forgetfulness does not affect the ability to carry out daily tasks. In contrast, abnormal forgetfulness may cause someone to forget how to cook a meal they have prepared all their life, or confuse simple steps when getting dressed. The key difference is that normal forgetfulness is annoying, but does not disrupt life, whereas abnormal forgetfulness may begin to affect independence, and this is where real concern starts. When we hear the word forgetfulness, our minds often jump directly to aging or Alzheimer's disease. But in reality, there are many unexpected causes that can lead to memory decline after age 60, and some of these causes can be easily treated. One of the most important causes is a deficiency in vitamin B12, which is essential for maintaining brain and nerve health. Its deficiency can cause mental confusion and difficulty concentrating, and it is sometimes mistakenly diagnosed as dementia. Similarly, thyroid problems, especially underactive thyroid, hypothyroidism, can slow thinking and significantly weaken memory. This cause is often overlooked despite being easy to diagnose with a simple blood test. We also cannot ignore the impact of chronic stress and anxiety, as ongoing psychological stress closes the doors of focus in the brain, making it difficult to store or retrieve information. Lack of sleep, especially deep and restful sleep, also weakens the brain's ability to consolidate memories. Even worse, some common medications, such as antihistamines or sedatives, may have a direct negative effect on memory. Simply put, not every case of forgetfulness after 60 means the onset of Alzheimer's. Sometimes it is just a warning signal for something that can be easily treated. As we age, maintaining brain health becomes vital. But the good news is that the brain can respond to stimulation at any age. There are 4 scientifically proven pillars that help strengthen memory and improve focus: nutrition, physical activity, mental exercises, and routine. First, nutrition. The brain needs proper fuel to function efficiently. Focusing on foods rich in omega-3s, such as salmon, walnuts, and flax seeds, helps strengthen neural connections. Likewise, antioxidants found in blueberries, turmeric, and leafy greens reduce inflammation that weakens memory. It's important to reduce intake of white sugar and trans fats, as these are linked to cognitive decline. Maintaining balanced levels of vitamin B12 and iron is also recommended because their deficiency leads to confusion and poor concentration. Drinking enough water is essential too, as dehydration directly affects brain function. Second, physical activity. Regular exercise boosts brain health in amazing ways. Brisk walking for 20 to 30 minutes daily increases blood flow to the brain and improves oxygen and nutrient delivery to its cells. Aerobic exercises like swimming and cycling support the production of BDNF, brain-derived neurotrophic factor, a key protein for the growth of new neurons. Even light activities such as stretching or yoga reduce cortisol, the stress hormone, levels and improve sleep quality, both crucial for memory. Research also shows that consistent exercise can delay the onset of dementia symptoms and maintain mental agility for longer. Third, mental exercises. The brain is not unlike muscles. The more you use it smartly, the stronger it stays. Crossword puzzles, picture riddles, and memory games stimulate different brain regions. Learning new skills like a foreign language or a craft, such as painting or knitting, enhances brain flexibility and creates new neural pathways. Everyday tasks, like organizing old photos, recalling details from the distant past, or trying to tell a story without help, are excellent mental workouts. The goal isn't perfection, but consistent stimulation and keeping the brain active. Fourth, routine. The brain loves organization, and daily routines reduce the mental effort needed to make decisions. Waking up and going to bed at the same time each day supports the biological clock and enhances sleep quality, which directly impacts focus. Organizing meals, walk times, and even reading or news-watching sessions makes the day clearer and less chaotic. Using notebooks, lists, or simple apps to remind about medications and appointments isn't a sign of weakness, but a smart way to ease memory burden. Additionally, simple daily rituals like drinking tea while reading a book or calling a friend at a set time give the mind a sense of stability and focus. Not every case of forgetfulness after the age of 60 is cause for alarm, but in some situations it becomes essential to consult a doctor without delay. There are warning signs indicating that the forgetfulness may go beyond the normal age-related changes and that there could be a deeper health issue, such as the onset of cognitive impairment or neurological disorder. If a person begins repeating the same sentence or question multiple times throughout the day without realizing it, or has difficulty remembering recent important events despite reminders, these are signs that require evaluation. Also, getting lost in familiar places, forgetting the way home, or failing to recognize close faces. These are all indicators that should not be ignored. Other concerning signs include sudden personality changes such as social withdrawal, increased irritability, or losing interest in activities once enjoyed. Forgetting how to perform simple routine tasks like making a cup of tea or using the phone also demands attention. Sometimes the cause is simple, like vitamin deficiencies, thyroid dysfunction, or side effects from certain medications. Other times, it may be the beginning of a more complex issue, such as Alzheimer's disease or other forms of dementia. Early diagnosis in these cases is not the end, but rather an opportunity to receive early support, effective treatment plans, and improved quality of life. The golden rule here is, if forgetfulness starts to affect independence or daily safety, don't wait. See a doctor. In the end, it is natural to forget some details as we grow older. The body changes, and so does the brain. We forget names, search for our glasses while they are on our heads, or wonder why we entered a room. These are human moments we all experience. At the same time, it is important not to dismiss every instance of forgetfulness as normal, just because it happens after 60. Sometimes, forgetfulness is a message from the body asking for our attention, extra care, or a timely visit to the doctor. Memory is not just a mental ability. It reflects our overall health, nutrition, sleep, and daily relationships. So don't neglect yourself, and don't hesitate to seek help when needed. Most importantly, don't be ashamed to talk about it. Silence may delay what can be treated early. Have you ever experienced forgetfulness that worried or upset you? Share your experience in the comments, or tell us a tip that helps you strengthen your memory. Your words might be the reassurance someone else needs today.